So yeah, I've been talking about Jessica Veloza, nurse practitioner, owner and operator of Proactive Wellness Academy and clinic. I've been talking about the energy of the things that are around you, including nature, but like also the items that you own and the things that you have, the way that they can impact you, and the way that like clearing out clutter, but also keeping the things that bring you joy or that have ultimate purpose. And that, so anyhow, I'm going to share some things that I keep in my daily bag, like the bag that I carry to work and the bag that I keep my computer in and my daily. So I'm just going to go through this. I've got this lavender lip gloss, and it's from some farm that like lavender farms the lavender, and it's really potent and good, and it's very good for irritated lips. Lavender oil can be very powerful for many things. In fact, I have lavender oil in a roll-on if I like scratch my leg, or if my lip is irritated, or if like I got some itchy thing or something that needs to calm down. I put a little bit of this on there. Or if I need to calm down, put it on my temples, behind my ear, maybe on my wrist, put some in my hand and sort of just smell it for a while. It interacts with you at a cellular level, so it's not hippy dippy stuff. Like it's measurably impacts you at a cellular level. And so lavender oil. On the note of the lip gloss stuff, I have another one that I got at the Integrative Dermatology conference that I went to in Tucson earlier this year. And this company I am not sponsored by, but if you want to sponsor me, Blissoma, beautiful packaging, beautiful ingredients. And this is like I think she told me, I need to look it up, but I think she said this is like $40 or so. It's crazy, but like I got this in August and I've been using it consistently most days. You can put it on your lips, and it's also kind of healing for skin and anything. So Biotonic Balm is what this is called. So I have been putting it like on the dryness of my little wrinkly stuff, and oh girl, that's some good stuff. I need to buy some more. I need to go to them. Like, I have considered investing in them as a product line. Okay, well, I have this cool pen that I have had since high school. Right now it currently has purple ink in it, but you can refill it with any Bic pen, and this thing came from Quarter Moon like in high school. Anybody remember that? I bet Rose remembers it, maybe. I have this box. I just sometimes, well, actually when I'm trying to fix my hair because it's thinned out a lot and losing weight and everything, and probably hadn't been eating as much protein as not practicing what I preach all the way, but was keeping pumpkin seed oil and a liver, like a beef organs supplement in here. I need to refill that. I have another sample that I got from the Integrative Dermatology Symposium, which is Tizo Photo Cuticle Skincare AM Replenish. This is a lightly tinted 40 SPF. Again, I am not sponsored by any of this stuff. This is just the stuff that I've been keeping in my bag that I will repurchase this. I got a full size sample from them, and I will repurchase this. I will repurchase that Blissoma. I buy that. Y'all saw that brand on that oil. By the way, I have another oil. I'm not on the brand. I have been in the past, but I actually like another brand better because it's more affordable, and I believe their sourcing is just as valuable, and their processing is just as reliable. And so, and they're cheaper, and they're not an MLM marketing. So we don't need to go into that. That's another video. But yeah, the 40 SPF, ceramides, antioxidants, C, zinc, broad spectrum, mineral based, none of the chemically garbage stuff. I have another pen. I've always loved these pens. This is the other oil, Breathe. I have asthma. I have eosinophilic asthma is what I've diagnosed myself, but it is allergy irritated and exercise induced also. But this Breathe oil has decreased the amount. I also am on, I take an inhaler right now. That's one of the things I need to work on healing for myself, because I have not gone to dive in deep on my lungs, but I need to. Anyways, Breathe Respiratory Blend. amazing. Like, I can use this on my kids, rub it on their feet, on their, like Vapor Rub. It's like Vicks, but like all natural. And I mean, just like super high quality, therapeutic. Absorbs into your skin, interacts with you on a cellular level. My yellow pen, my Proactive Wellness color. It's funny because like black and gray and brown were my favorite colors for a really long time. And I am practicing to, just what I keep saying about energy. Like, my husband's been telling me to wear colors forever because he says, you know, I look good in colors and blah, blah, blah. And I have been not doing it. So that's why I'm doing all this energy transfer from the colors, energy transfer from the foods you eat. So like, you know, I have a lot of people that come to me in great distress, and often, I like to do add supplements before we really dive in on the nutrition, even though that's kind of like, you're not gonna get things better if you don't manipulate what's going into your body. But individualized person-to-person care requires that we do what's best for what is going to be most likely to help you succeed and move in the right direction, even if it's by a tiny couple of inches at a time. And so that's where this deep dive functional coaching comes in. Like, we get you feeling better, but once we can, anyways, long story short, a clippy clip. This card, these are outdated. Like, I really need to redo these, but I printed these in a flash the night before it was like my 20th year anniversary reunion from high school, basically. But it was a little late because they do a reunion anyways, but I wanted to, so I went and I printed these out like in a rush, and the place could only print one-sided cards. So we printed 2 sets, one with the front, one with the back. And my cute little child, Zachy Blue, he glued these together, like hundreds of them. And guess what? I only handed out like 2. I don't know why I thought I was going to have like high level courage to continually hand my stuff out at the thing. But hey, this is another supplement. Another sample that I got from Integrative Dermatology Symposium in Tucson this year. And it's by Learn Skin, by the way, since I keep talking about that symposium. I guess I'll go next year. There's so many I want to go to. And dermatology is an area where a lot of people need a lot more support, and we're really not doing a great job, in my opinion, mainstream. Like, there are a lot of things that I try in my practice, in my mainstream primary care practice, before I send people to derm. There's a lot of times that when I do send them to derm, they do not come back with a better answer than I was able to provide. So I do want to expand more on those psoriasis, and it's really related to the gut. So you really just can't fix an isolated problem. You can't really fix just like an isolated problem. So anyways, but this stuff is supposed to like help when your face looks all hollowed out after using a GLP-1, and it's supposed to be pretty effective. I have a couple people who have purchased it that I'm waiting to get their personal feedback on. This fine rose oil, I saw a study, I don't know if it was true at all, but it was like a picture of an active MRI or something, and it was like before rose oil, after like 4 weeks of using rose oil every day, and the brain was like much more ignited and activated. That's all the stuff I wanted to share out of my bag. I threw it from one hat to another. I just have been feeling inspired, so I know that it's just dorky and extra, the amount of things that I am posting, but I'm trying really hard to keep my mindset correct and continue believing in myself, in my ability, in my worth, in my ability to grow and evolve and trust in what the universe and God has waiting for me, in my ability to trust myself and my intuition regarding what feels right. So more around proactive wellness and the services I offer and the business I'm building. Sorry, that's not the type of coffee we want. That's another conversation, coffee. But yeah, the kind of business that I'm building, I started opening it I opened my doors April 12th, which is actually my doggie's birthday. But it was like I didn't feel right? I had followed a bunch of, the evolution of it has been interesting. I followed a bunch of people who had done what I wanted to do, you know, like I always talk about. But I really like got it drilled into my head with the one guy that I had been listening to all this stuff. Don't get me wrong, he propelled me, the elite NP propelled me into a place where I believed that I could do it, where I believed that it was possible, where I believed that from a business perspective, that learning curve, that I could make that happen. Because, you know, every day in my general practice, when I'm like seeing patients and taking care of patients and feeling like my soul sucked out and all this stuff, I mean, honestly, I get a lot of joy from my patients. But in dealing with the insurance companies, denials, dealing with having to make medication and supplementation and recommendations, completely relying on insurance companies going to deny that stuff almost all the time. It's just so often. Even stuff like your iron is low and they don't want to cover the iron pills, or they won't cover the vitamin C a lot of times. And I know like guidelines say it's not required to give it with vitamin C, and some studies have indicated that they don't even think it makes a big difference, but it does. But then to the other side of that, like the dang prescription ones are trash anyways. Give me a good Mega Food blood builder. Take 1 to 2 caps a day if you're anemic, and we will take care of that. And that reminds me, I sent someone to hematology recently because their iron was low, but by the time it took so long to get an appointment with them, and actually this is still a good thing, but this is just a one-off, that by the time they went for probably iron infusions is why I referred them, because this is the thing. I started her on iron supplementation prescriptive. It's either Medicaid or Ambetter, low insurance, something like that. And she couldn't tolerate it because of the constipation, the GI upset. She couldn't take it without food, so the absorption got decreased a lot. They didn't cover the vitamin C, which, you know, it does. Iron needs vitamin C to transport, if you look at biochemistry. So it is an assisting, they're synergistic. Anyways, but so she took them for 8 months and her iron got worse. I'm telling you, her labs got worse. And this is when I referred her, like in maybe March, to go to hematology. Pretty sure, I don't know. Don't quote me on timelines. But at the end of the day, it took a long time. It's probably her fault. I'm not saying it's hematology's fault. Sometimes they take a long time. Cardiology can be out like 6 months. There's a lot of denials from insurance. There's a lot of denials from, well, the office tries to get a hold of these people and they don't answer the phone is a big problem. So I'm just referring out to specialists, and being a system that is so disconjointed it's just illogical. And what it does is it creates a lot of frustration and confusion. It creates a lot of miscommunication, and it creates a lot of mistrust within the system. And blame on the trucker. Would you? Like, tell me, let me survey. Please comment anyone who has experienced medical trauma. This is another hot topic you keep me talking about all the time. Like, how many people do I meet that are like 50, 40, 30, but, you know, 50, 60, who haven't been to a doctor in 10, 20, 30 years, who have never seen a doctor in their adult life? I'm not saying, you know, sometimes some of these people, if they're doing lifestyle appropriately and they're conscientious, maybe if they listen to something homeopathic that grandma, great-grandma, auntie, their friends, moms, dads, uncle, whatever, if they somehow like Dr. Sebi, or they decided to self-educate, and they are doing little things like, oh, yeah, I heard apple cider vinegar good for my blood sugar. So, you know, stuff like that, that they lean, and they're not drinking and eating a lot of highly processed fake foods, and, you know, or even a lot of times if they are. But anyway, sometimes these people can be better off if they dodge a little bit of medical. There's a fine line, but there's definitely like a spectrum of appropriate intervention, and we do a lot of inappropriate over intervention. But yeah, the thing is I would really love to get to people before they reach that point. And I just watched the Kevin Hart special on Netflix last night, and he's like, it's called Acting My Age, and he's like, you know, it was really just, I already watched the Jamie Foxx special, because he talked a lot about his health. And so like Kevin Hart, I mean, I'll be straight up honest, I love both of y'all, but Jamie Foxx's was a lot more moving. And but I could see how Kevin Hart did his thing, and he did his thing true to himself, and it was like very smart and witty, and it's like a writing piece that it was like a beautiful piece of art that caught in the time frame that, he said so much good stuff. But it was like, a lot of it was things it caught me cracked up laughing 4, 5, 6 times. But the Jamie Foxx one was like different. They're both amazing, y'all. If you want a long, crazy, good night, watch the Jamie Foxx special and then the Kevin Hart special on Netflix, and the new comedy, their stand-ups talking about being older. So yeah, where I got cut off from my last video was that Kevin Hart was talking about, like, he's 45 and he was like, get in and do preventative health care before you turn 55 and have coronary artery disease. Do the lifestyle stuff. Yes, some people that dodge doctors forever do better. People that don't end up on 20 meds generally do better. And that's a patient-specific thing. Some people, there is a place for medications, but it depends on you personally, independently, uniquely. So most people that don't seek any type of preventative care anyways, I'm not saying it has to be mainstream. Like, it can most totally certainly be functional medicine, independent alternative practitioners. I have met so many more like small town, good old boy type people that want direct primary care. So even though it sounds high, I'm charging $95 a month. But you have to understand the amount of input that you get. You can text me, you can call me. It's like midnight. I'm not saying I'm always going to answer, but if I get up to pee at 2 a.m., you better believe I'm calling you back or calling you in or something, or at least the next morning or soon. You know what I mean? I'm not saying call me in case of emergency. Call 911, go to urgent care. But what people really want is somebody who can get down in the nitty-gritty with them if they need to. If I'm telling you your blood pressure is high, you want to know exactly what you need to do that's going to help you. You don't want me to just read a list of stuff from a medical book like this that tells you eat less salt. And what your practitioner needs to be able to do, what your coach needs to be able to do, is figure out what is it that you are uniquely doing in your life. What are you eating? What are you drinking? What kind of repetitive activities are you doing? What thoughts are you repetitively allowing through your head? What are your biggest fears, hopes, dreams, desires, phobias? What pisses you off? You know what I mean? And then what do you do? What do you eat? What do you drink? What do you put into your mind and into your mouth? You just have to know that in order to, and then there's a magical thing that happens with providers who have like the level of knowledge and expertise combined with a passion to help people. And that is that golly, I need to practice what I preach surrounding ADHD. I need to implement the workbooks and the reading and the practice that, listen, I am not distracted driving. I am in the neighborhood. I am not looking at the phone. I'm looking at the road. So anyhow, I cannot remember what I was going to say. So I guess we're going to leave here for now. Love you already.